Alright, so I'm going to be showing you how to administer an enema, and this is our friend Neville. I'm just going to be doing a simulation on him. So I have my supplies over here. I have my gloves. I have some lubricating gel, some sterile lubricating gel. I also have a 60 ml Lurelac syringe. I have some polyethylene glycol 3350. I have an size 8 red rubber tube here, and I also have some gauze and a bowl. Now, what I want to go over is at this hospital, we're actually moving away from enemas, so we have this already pre-mixed single dose enema here, which contains diacetyl sodium, sulfosinate 250 milligrams. So if we were to make one up, the doctors here use a mix of the polyethylene glycol 3350 and a little bit of lube and some more water in a bowl. Now the suggested dose for this guy would probably be about 60 cc's. So we don't really have, the doctors here don't really have a ratio that they use. It's more just kind of for the consistency and also the amount of constipation that's going on with a patient. But we would definitely start out with 60 cc's and probably do about 30, see how he does, and then go from there. So obviously too, if I was going to actually be doing a real enema, I would definitely have him in a tub or on a wet sink. So that, because a lot of times immediately after you do the enema, that's where, they kind of let loose. So I just wanted to make that known ahead of time. All right, so I'm going to move his chart over. Sarah, if I could have you just kind of give him a hug if you want to put his butt end this way, and then I'm just going to go about if I were to do an enema. So I'm just going to put these gloves on here. No, it's okay. Good boy. Yeah, it's okay, buddy. So, I'm going to move to this end here. I'm going to move this off the counter just so he doesn't kick it or anything like that. So I'm going to move to this end here. Now, if we were to do an enema, I would just got to open this lube here. I want to make sure you use a sterile lube. So put some lube on here. Then what you want to do is open your red rubber tube. And I'm also going to open the cap here. Now what I would do is I would put some lube on my finger, and then I'm just going to do this part as if I were to. I'm going to put some lube on his anus here. I'm going to grab the tube, and then what I would do is I would insert it 1 to 3 inches gently into his anus, so it would probably stick about this far in, and then I would put my enema on, slowly and carefully push it through. You want to make sure you're in far enough so it's getting behind, the feces that is in his rectum, and then I would slowly push this in until, the whole thing is in there. Then I would pull it out, and you have to be ready, for that kind of quote-unquote explosion right afterwards. So like I said, we would have him in a tub or a wet sink, so then when he did, let loose of his feces, we would clean him up and, wash his behind and keep a close eye.